Have you ever noticed your skin suddenly becoming red, painful, and starting to peel off like a bad sunburn? But much worse. What if I told you this could be your body reacting badly to medicine you've just started? That's what happens in toxic epidermal necrolysis, or TEN, a rare but life-threatening skin condition. Think of your skin as your body's superhero suit, protecting you from germs and heat. In TEN, this suit starts falling apart. It's a type 4 hypersensitivity reaction, meaning your immune system attacks your own skin cells after mistaking them as dangerous, all because of a medication trigger. Scary, right? But knowing about it can help save lives. So what actually causes TEN? Most of the time, it's medicines, especially certain ones like antibiotics, such as sulfa drugs, anti-seizure medications like carbamazepine, or pain relievers like NSAIDs or allopurinol. Imagine your immune system as a security guard. Normally, it checks IDs and lets the right people medicines in. But in some people, the guard gets confused and sounds the alarm on a harmless medicine. This sets off a chain reaction where your immune system starts killing your own skin cells. Sometimes infections like Mycoplasma pneumonia or even vaccines can trigger it, but medicines are the usual suspects. Not everyone gets TEN from these drugs, only certain people with specific genes like HLA-B1502 are more at risk. It's like having a unique alarm system that overreacts. Let's say you started a new medicine 2 weeks ago. Now you've got flu-like symptoms, fever, sore throat, feeling tired. Then your eyes sting, your mouth burns, and you notice red spots spreading fast on your skin. These spots turn into blisters, and large sheets of skin start peeling off when you gently rub it. That's a key sign, Nikolsky's sign. Try this, gently rub the side of your hand if you had these rashes. If the top layer slips off easily, that's a big red flag. The pain can be extreme, like being burned without a fire. Mucous membranes, eyes, mouth, genitals are often involved. If over 30% of your skin is affected, it's diagnosed as TEN. Less than 10% is called SJS. It spreads fast, so fast that patients often end up in burn units for care. Diagnosing TEN is urgent. Doctors will ask, when did you start any new medicine? They'll examine your skin and may do a biopsy. A small piece of skin is taken and checked under a microscope. It shows how the skin layers are separating and cells are dying. Blood tests check for infection and organ stress. The SCORTEN scale is used. It scores things like age, heart rate, and how much skin is damaged to predict how serious it is. Treatment first, stop the triggering medicine immediately. You'd be moved to an ICU or burn unit. There, doctors treat you like a burn victim: fluids, nutrition, wound care, and preventing infection. Sometimes, medicines like IVIG, intravenous immunoglobulin, are used to calm the immune attack. Steroids are debated, helpful for some, risky for others. Recovery can take weeks, and healing skin may be sensitive or scarred. Can we prevent TEN? Yes, and it starts with awareness. If you know you're allergic to sulfa drugs or have a family history of bad drug reactions, tell your doctor before starting any new medicine. Genetic testing helps in high-risk groups. For example, people of Southeast Asian descent getting carbamazepine should be tested for HLA-B1502. It's like checking your car's manual before using new fuel. Doctors should review your medicine list every time. Pharmacists can flag risky combinations. Never ignore early rashes after starting a drug. That's your body's alarm. Prompt action saves lives. Education for both patients and doctors is key. Think of it as teaching everyone how to spot the early warning signs of a false immune alarm. Recent research is bringing hope. Scientists are studying biologic drugs, medicines that target specific parts of the immune system, like TNF-alpha or IL-15 blockers. Early trials suggest they might stop the skin destruction faster. Gene screening is becoming more common, before prescribing high-risk drugs. Some hospitals now use rapid DNA testing to check for HLA risk genes within hours. Also, stem cell therapy and lab-grown skin are being tested to help severe cases heal faster. There's even a global registry, like an international database, tracking all 10 cases to learn more. Every patient's story adds to science, helping doctors predict, prevent, and treat this disease better. Knowledge really is power, especially when your skin depends on it.